Imagine waking up in the middle of the night with a pain so intense. It feels like someone is driving a burning nail straight into your jaw. You can't sleep. You can't eat. Even breathing makes it worse. Now imagine this isn't happening today. Imagine it happened 7,000 years ago. No dentists, no painkillers, no antibiotics, no anesthesia, no hospitals, just you, a rotten tooth, and the terrifying realization that this tiny piece of your body might actually kill you. Here's something most people never think about. For thousands of years, a toothache wasn't just painful, it was deadly. A simple infection could spread through your jaw, enter your bloodstream, and end your life. So how did ancient humans survive? The answer is far stranger and far more shocking than you might imagine. Today, if your tooth hurts, you call a dentist. Maybe you get a filling, maybe a root canal. Maybe the tooth is safely removed while you're comfortably numb. The worst part is usually the bill. But ancient humans had none of those choices. They had herbs, alcohol, prayers, primitive tools, and sometimes someone who simply believed they were brave enough to pull harder than everyone else. For thousands of years, survival often depended on hope and luck. But then archaeologists made a discovery that completely changed what we thought we knew about prehistoric people. Deep inside ancient burial sites, researchers found something incredible: human teeth with perfectly drilled holes. Not cracks, not damage from accidents. Someone had intentionally drilled into those teeth. The discovery shocked historians because these teeth were around 7,000 years old. Think about that. Thousands of years before the Egyptian pyramids, long before Rome, long before written history, humans were already performing dental surgery. But here's the question: how could anyone survive having a tooth drilled with nothing more than a stone tool? The answer lies in one of humanity's greatest strengths: the will to survive. Researchers believe these prehistoric healers used tiny flint drills, probably powered by a simple bow drill. The same tool used for making beads and carving stone was now being used on human teeth. It sounds terrifying, and it probably was. But there's an amazing detail many people miss. Some of those drilled teeth show years of wear afterward. That means the patient survived, recovered, and kept using those teeth for years. In other words, the world's first dental procedures may actually have worked. Not because ancient people understood bacteria, not because they knew modern medicine, but because they refused to give up. When pain became unbearable, they experimented, they observed, they searched for solutions. And sometimes, against all odds, they succeeded. But if you think drilling into a tooth with a stone tool sounds horrifying, what came next was even stranger. An entire civilization became convinced that tiny worms were living inside human teeth, eating them from the inside out. And believe it or not, millions of people accepted that idea for thousands of years. Imagine looking into someone's mouth thousands of years ago. You see a black hole in the tooth. The person is screaming in pain. The tooth slowly crumbles apart. Without microscopes, without science, what would you think caused it? The people of ancient Mesopotamia believed they had the answer. Tiny worms were living inside human teeth. They believed these invisible creatures chewed the tooth from the inside, causing pain, decay, and suffering. It sounds ridiculous today, but if you've ever seen a badly decayed tooth, you can understand why they believed it. It really does look as if something has been eating it from within. And surprisingly, this strange idea didn't disappear. It survived for thousands of years. Here's the shocking part. The toothworm theory wasn't limited to one kingdom. Versions of it appeared across Asia, the Middle East, and even parts of Europe. Different civilizations, separated by thousands of miles, came to almost the same conclusion. How is that possible? Because they were all trying to explain the same mystery with the knowledge they had. The explanation was completely wrong. But sometimes, a wrong explanation can still lead to useful discoveries. And that's exactly what happened next. Mesopotamian healers tried everything they could think of. They recited prayers, performed rituals, burned herbs, applied natural medicines directly to painful teeth. Did these treatments kill imaginary worms? Of course not. There were no worms. But here's the fascinating twist. Some of those herbs naturally reduced swelling and eased pain. Without realizing it, they had accidentally discovered treatments that actually helped. History is full of moments like this. People guessed the wrong cause, yet stumbled upon the right solution. And nowhere is that more surprising than in ancient Egypt. When most people think of ancient Egypt, they picture pyramids, pharaohs, and golden treasures. But Egypt also left behind some of the oldest medical writings in history. Inside those ancient texts were recipes for treating tooth pain. One ingredient appeared again and again: honey. At first, that sounds like an old folk remedy. But modern science tells a different story. Honey contains natural antibacterial properties. It can help slow the growth of certain bacteria and protect damaged tissue. The Egyptians had no idea what bacteria were, yet one of their favorite dental treatments may have worked for reasons they couldn't possibly understand. Sometimes, ancient wisdom arrived long before modern science could explain it. Egypt wasn't just creating remedies, it was creating specialists. Some historical records describe people whose primary job was treating problems of the mouth and teeth. They weren't dentists in the modern sense, but they were among the earliest known professionals dedicated to oral health. That was an extraordinary idea over 4,000 years ago. Instead of accepting pain as fate, they searched for people with experience, people who knew what might actually help. Humanity was beginning to realize something important. Tooth pain wasn't a curse. It was a medical problem. And somewhere else in the ancient world, another civilization was about to make an even bigger breakthrough, not by treating toothaches, but by preventing them before they even started. What if the world's first toothbrush wasn't made of plastic? Or even wood? What if it was nothing more than a simple tree branch that modern science now says actually worked? Long before toothpaste, long before toothbrushes, and long before anyone understood bacteria, the people of ancient India had already discovered something remarkable. Instead of waiting for tooth pain to appear, they focused on preventing it. Their secret? A simple chewing stick cut from specific medicinal trees. At first, it sounds primitive, just a small twig, nothing special. But modern research has revealed something fascinating. Some of these plants naturally contain antibacterial compounds that help reduce harmful bacteria in the mouth. Without microscopes, without laboratories, ancient people had discovered an effective way to keep their teeth cleaner, simply by observing nature. Sometimes, the simplest ideas survive for thousands of years because they actually work. While India focused on prevention, ancient China developed a different understanding of tooth pain. Chinese physicians believed that health depended on balance within the body. When that balance was disturbed, pain appeared. Their treatments included carefully selected herbs, natural medicines, and in some cases, acupuncture. Did every treatment work? Not always. But Chinese doctors did something incredibly important. They observed. They recorded symptoms. They compared patients. And they searched for patterns. Throughout history, careful observation has often been the first step toward real medical progress. Then came ancient Greece. And this is where the story takes a major turn. For centuries, many people believed disease came from angry gods or mysterious spirits. But Greek physicians began asking a different question. What if illness has natural causes? One man helped change the way the world thought forever. Hippocrates. Today, he's known as the father of medicine. Instead of blaming magic, he believed diseases came from physical problems inside the body. That idea sounds obvious today, but over 2,000 years ago, it was revolutionary. Greek doctors recommended mouth rinses, healthier diets, and when absolutely necessary, removing damaged teeth. Humanity was slowly replacing superstition with observation. And that changed medicine forever. But the next chapter may surprise you the most. While much of Europe struggled with painful extractions, a different part of the world was making remarkable medical progress. Doctors were writing detailed books about oral diseases, improving treatments, and preserving knowledge that would influence medicine for centuries. As Europe struggled through the Middle Ages, a different story was unfolding across the Islamic world. Cities like Baghdad, Damascus, and Cordoba became centers of science and medicine. Physicians carefully studied the human body. They translated ancient medical knowledge, improved it, and passed it on to future generations. One of the greatest physicians was Ibn Sina, known in the West as Avicenna. In his famous medical encyclopedia, he described diseases of the teeth and gums, methods to relieve pain, and the importance of careful diagnosis. For the first time, dentistry was becoming more than simply pulling out painful teeth. It was becoming a true medical science. Humanity was finally beginning to understand that treating the cause was just as important as treating the pain. But not everyone had access to skilled physicians. In much of medieval Europe, if your tooth became unbearable, you often visited someone you already knew, your barber. Yes, the same person who cut your hair and shaved your beard might also remove your tooth. These barber surgeons performed minor surgeries, treated wounds, and extracted teeth. There were no x-rays, no sterile clinics, no anesthetic injections, just simple metal tools, strong hands, and a patient hoping everything would be over quickly. For many people, it was the only option they had. As time passed, a new profession appeared: traveling tooth pullers. They moved from town to town, setting up in busy marketplaces. Crowds gathered to watch. Some even turned extractions into public performances to attract customers. It sounds unbelievable today, but it reminds us of one important truth. Tooth pain was universal. Rich or poor, king or farmer, everyone feared it, and everyone desperately wanted relief. Then came one of the greatest breakthroughs in medical history: anesthesia. For thousands of years, people feared dentists because dental treatment itself was agonizing. Anesthesia changed everything. Patients could finally receive treatment without unbearable pain. Soon after came better instruments, improved hygiene, x-rays, modern fillings, root canal therapy, antibiotics, and a deeper understanding of bacteria and infection. For the first time in history, a toothache was no longer a life-threatening problem for most people. It became something that could actually be treated safely. When you step back and look at this incredible journey, one pattern becomes clear: prehistoric stone drills, the Mesopotamian tooth worm theory, Egyptian honey, India's chewing sticks, Chinese observation, Greek medicine, Roman dental tools, the scholars of the Islamic Golden Age, barber surgeons, traveling tooth pullers. Every civilization faced the same challenge: a person in pain, searching for hope. History changed. Empires rose and fell. Technology transformed the world. But one thing never changed: the human desire to ease another person's suffering. That simple goal has driven thousands of years of innovation. And every time you sit in a modern dentist chair, you're benefiting from a journey that began over 7,000 years ago.